let's talk about how badly the current system is failing Oklahomans. America's health rankings put Oklahoma 46th in the country in health behaviors and outcomes. We're one of the worst in the country in obesity and diabetes rates. We have the third most deaths from heart disease. We have the sixth highest smoking rates in the country. This is unacceptable to me, and I know it's unacceptable to all 4 million Oklahomans. Our state demands better. Oklahomans hired me to bring a fresh set of eyes to state government. As governor, I wouldn't be doing my job if I went along with business as usual. The longer we wait to fix this problem, the farther behind we fall. This summer, voters put Medicaid expansion in our Constitution. Every other state in the nation with Medicaid expansion also has managed care. Every other state in the nation, because it works. 40 states have found managed care is the best way forward. Texas, Kansas, Iowa, Tennessee, Florida, even California and Illinois. Let me emphasize, this is not political. This is not a red state thing or a blue state thing. This is just the right thing to do. Here's the bottom line. Oklahomans deserve better, and we're gonna get better. A healthy Oklahoma is a prosperous Oklahoma. As leaders, we have a moral obligation to make life better for the people that we serve. Business as usual will not make us a top 10 state. Changing how we deliver health care to Oklahomans is the right path forward. I want to bring up Kevin Corbett now to give you some more details. Secretary.
Thank you, Governor, and thank you for your leadership as well. This is a lengthy process that we've been under. It's a pleasure to be here with you today. And before I announce the partners we've selected to assist us in executing our comprehensive managed care delivery system, I must take the opportunity to first thank and applaud our staff for their passion and their extensive time and effort to make historic transition into managed care. While we have many more steps ahead, I appreciate the tremendous dedication and diligence our staff has made thus far. This was a collaboration with our friends at the Department of Human Services and the Department of Mental Health and Substance Abuse Services. I would like to thank Secretary Brown, who is here with us today, as well as Commissioner Slatton Hodges. Their support has been invaluable. Thank you, Justin. You know, this journey has not come easy. We started this work in June of 2020, examining countless amounts of data, obtaining input from other states the governor mentioned that have made this transition, and addressed issues that hindered past attempts at managed care. These are all significant steps in reaching our ultimate goal of improving the lives of nearly 1 million Oklahomans currently in need of Medicaid. I would also like to take this time to extend my gratitude to our board for their thoughtful engagement and sometimes difficult deliberations in this process. Our board chair, Stanley Hupfeld, is here today, and Stan, I'd like to say thank you to you and the rest of the board. Today is a great day for the future of public health in Oklahoma. We do have the opportunity to change the course of health care, to disrupt the current path we're on. Being ranked 46, as the governor mentioned, in the country in health outcomes can no longer be our norm. A managed care delivery model will allow the state to improve these health outcomes for Oklahomans, improve access to prevention and treatment services through better care service and coordination, all while increasing cost predictability in the state of Oklahoma. Partnering with these organizations today will represent one of the largest procured contracts in the state's history, and yet the amounts associated with it are staying right here in our state. These managed care organizations already do business in Oklahoma. They are increasing employment, and they are partnering with our provider network. And they don't take the important task ahead lightly, and they are ready to start serving Oklahomans in this new way. And now, without further delay, let me introduce our new partners. First, Blue Cross and Blue Shield. Blue Cross and Blue Shield of Oklahoma has been a trusted partner as the state's oldest and largest member-owned health insurance. Blue Cross Oklahoma's fully integrated fiscal, behavioral and social health community-focused care model will leverage different approaches based on specific member needs and preferences. Their existing collaborative partnerships with over 300 Oklahoma community organizations will be engaged to address health disparities for our Sooner Select program, with a focus also on housing, food insecurity, health literacy, education, and employment. Joining us today from Blue Cross and Blue Shield is Dr. Joseph Cunningham. Thank you, Joe. Thanks for being here. Joe is the president of Blue Cross and Blue Shield. He's also a resident of Oklahoma and brings a wealth of knowledge to our team, and we're glad to be doing business with him. Our second partner who we've selected to work with is Humana Health Horizons in Oklahoma. Humana has proudly served Oklahoma since 1987. Through their demonstrated capabilities in population health, value-based payment models, and chronic care expertise, Humana is well positioned to address challenges faced by Oklahoma's most vulnerable communities. We're joined today by CEO of Humana Health Horizons in Oklahoma, Joe Fairbanks. Joe is a native Oklahoman. He's been here for 35 years, and we're great that he's going to be with us again. Our next partner is Oklahoma Complete Health, a subsidiary of Centene. Oklahoma Complete Health is headquartered in Oklahoma City. They have close partnerships with local health providers, urban and rural community organizations, and children's service organizations. Joining us today is Senior Vice President of Business Development, Zane Yates. In the coming days, we'll introduce the CEO, who is an experienced local healthcare executive. And our fourth and not final healthcare partner is UnitedHealthcare. UnitedHealthcare has been committed to improving the health and well-being of Oklahomans since 1985. United worked closely with us to deliver health managed care solutions and improve the overall health and well-being of Oklahomans through whole person coordinated care, which addresses both physical and mental health needs, as well as social services and support with food, transportation, and employment and housing. Joining us is the CEO of United Healthcare Community Plan of Oklahoma, Megan Haddock. Megan is no stranger to Oklahoma, born in Bixby. She lives there now with her husband and children, and we thank you for being here, Megan. As our team and these four partners build and strengthen the new partnership, we will share with you over the coming weeks the many benefits that they will provide to our Sooner Select members. And now what I'd like to do is ask Senator Kim David for her remarks about our undertaking journey.
Thank you, Kevin. I'm honored to be here today, as well as thrilled to be here today. This is a topic I have been passionate about for many years. 40 other states have contracted with partners to provide access to care and to ensure the best health outcomes. This will be especially important as Oklahoma moves into the expansion population. The people we will be serving need to be helped in finding that primary care provider. They need that caseworker to help hold their hand and help guide them through this system. We need someone to help them follow up on their healthcare needs and to make sure they're doing what needs to be done. These are the people I serve and I'm passionate about. A healthier population is our end goal. To get there, we need to focus on preventative care, disease management, and incorporating behavioral health needs. Governor Stitt wants Oklahoma to be top 10 in the state in healthcare, and so do I. So do all 4 million Oklahomans. Other states have consistently achieved better health outcomes by managing the health care of their people. Providing these wraparound services is a move in the right direction. This selection is incredibly impactful also to the local economies. Those local towns in my district and everyone else's district that serves the state, new jobs will be coming on the horizon. This will generate more than 1,000 new jobs in holistic quality health care for senior care members. And this is really an opportunity for us to move the needle. I would like to also welcome back Secretary Corbett. Thank you so much.
Thank you, Senator, and I look forward to working with you and your colleagues in the months ahead. We certainly do appreciate your support throughout this process. Now I'd like to ask Dr. Deb Shropshire to give her comments. Dr. Shropshire serves as the Child Welfare Director for the Department of Human Services. She has spent the last 20 years working on behalf of Oklahoma children in the foster care system, both as a physician at OU Health and as a leader in the child welfare system.
Well, thank you, sir. And thank you for your leadership, your continued leadership of our great state. Thank you to everyone who's attending today's exciting announcement. We've selected one statewide vendor to assist us in providing managed care to the children in the custody of Oklahoma Child Welfare and Oklahoma Juvenile Affairs. That vendor is Oklahoma Complete Health, and we're very excited about the selection. The population that will be served by that plan includes children who are in foster care, but it also includes opportunities for children who've been adopted, for those children and youth, those youth who have aged out of our foster care system, as well as families who are being served through prevention cases that are involved with child welfare. This contractor will work closely with Oklahoma Human Services, with the Juvenile Affairs, as well as Oklahoma Department, Child Welfare, in implementing their plan in Oklahoma. We've identified about 30,000 people who will be eligible for this specialty plan. This opportunity is the first time at least in recent times, that these children will be in a managed care coordination model. And as a provider who's taken care of a number of these kids over the years, I can tell you that we've seen times when initiatives that improved health opportunities for other children and youth didn't really fit children in the foster care system, and we were typically carved out of initiatives like the patient-centered medical home model. So we're very excited for this opportunity to do something that serves our kids. Having one statewide vendor will ensure continuity of care and continued access to needed medical and behavioral health services no matter where in the state children are placed or may need to move. Those transitions happen. This plan will help us ensure that that care is consistent. Having a single statewide care coordinator and care coordination system will remove a lot of the stress and the work from my staff, child welfare staff, who serve as the case managers for those children on the child welfare side, and it will allow them to focus on the day-to-day needs of that child in their custody rather than spending a lot of time and resources trying to access health care for that child. The MCO will also participate in ensuring that children receive needed health screenings, and that as they enter the plan, that we understand their health and their behavioral health needs earlier in a way that we can address those needs. Care coordination at this level is instrumental in ensuring that care is integrated for these children in a manner that sets our kids up for success at home, at school, and as they move toward adulthood. Plans will have more flexibility in how they reimburse and incentivize providers so that we truly will have providers with expertise in how to take care of children who find themselves in the care of the state of Oklahoma. Now I'd like to welcome Rhiannon Calvi.
Hello, my name is Rhiannon Calvi. I'm a single mother to an almost 2-year-old named Nolan. I'm currently a full-time student at Southwestern Oklahoma State University, pursuing a degree in organizational leadership, with the hopes of applying to OU in a few short semesters to major in human relations. I also serve on the member advisory task force for the Oklahoma Healthcare Authority. After losing my private health insurance due to a divorce, I applied for student care for my son Nolan. On a whim, I decided that I would apply too, just to see if I would be accepted. By late November, I received a letter that we are both accepted for student care. Unfortunately, a few weeks later, my breast started to swell and hurt. Upon doing a self-exam, I discovered a lump. I waited a week or two before I became concerned, and it was time to call the doctor. Unfortunately, I was all alone and didn't know where to go or what to do. This is when I made the decision to ask for help from the other members of the advisory task force. The members gave me their opinions and told me what I should do. I took their advice and I started calling all the doctor's offices that I could get a hold of. I ended up calling 6 different doctor offices before one finally accepted me as a patient. After being seen by this doctor, and I started a round of antibiotics for the lump on my boob. I scheduled an appointment for 2 weeks later, but unfortunately we found out that the antibiotics did not work and my breast was getting worse. My doctor then scheduled me for an ultrasound. Throughout this whole process, my doctor has explained to me why she ordered the antibiotics and the ultrasound before doing any other tests or imaging. She went out of her way to ensure that I understood what she was doing and why. This whole process has made me realize that not everyone has such a great support system to lean on, or a doctor who will explain every step of the process to them. However, there is something that can be done about this, and that is managed care. Managed care sounds scary and controlling, but it's quite the opposite. Managed care is there to guide you and direct you, to be that shoulder to lean on when you don't know where else to go or what to do. The managed care system would have helped me so much more if I had it then. And hopefully, soon, it will be able to help all Oklahomans who need help whenever they find a lump or go through a traumatic experience. Thank you so much.
Thank you, Rhiannon, for sharing your story and your experience. I think it's a real motivator for us that serve in this industry. With that, I think we'll take it open for questions.
Secretary Corbett, I know that the contracts, well, what the board approved earlier this week was spending up to $2.2 billion or $2.1 billion on these contracts. Can you give us a breakdown of how much each company is being paid for managed care?
Yes, I will. These are, they are the same payment structures for all the companies. It's based off a per member per month. So that cost is equal to all the plans based on that membership.
So it just depends how many members sign up for, let's say, the Blue Cross Blue Shield plan, and if they get, 500 members to sign up, then they'll get X number of dollars.
That's correct. In basic terms, that's correct.
Secretary, these bids were due just a couple months ago. When you're talking about thousands of pages, I would think, and very complicated documents. How effective were you able to be on such a short time frame?
We've had a team working since June on this whole process and recognized what they were going to have to do to go through the proposal process. Had a large team of evaluations, as we do in the state for procurement purposes. Yeah, they worked around the clock. That's the reason I applaud them today, is that they took the holidays and did all the work that we needed to do, including oral presentations with those who wanted to propose to us. So I'm very comfortable in the extent of the work they did, the dedication they put into it, the diligence they did, and they made the right decisions.
Senator David, can you speak to the legislative perspective on this in terms of, obviously, a lot of lawmakers are remotely opposed to managed care. How are you going to go about ensuring funding for this gets over the finish line?
Well, constitutionally, we have to fund the expansion population. So there is no doubt that we will absolutely fund this. And as to the few members who are against this, I think a lot of my members, some of those who have been outspoken about it, don't understand exactly what the concept is. They know what they've been told, and they know they should be afraid. And then I have several who stand to gain by keeping the system the way it is. And our objective is to get better health outcomes. And that's going to be our focus on this, and that will be my focus with my members moving forward.
What about the bills that will hinder, I guess, this? I mean, I'm aware of one that the managed care would be able to go through without legislative approval. Would you grant those a hearing on the floor if they make it through?
Well, at this time, we will work those through the process. But I am the stopgap, excuse me, for legislation, and it will have to be something that as overwhelmingly as a whole that we decide not to do. But that's not the case at this time.
My understanding is that the contracts are initially for one-year terms and that they can be renewed after that. When do they start?
They will start when we launch the plan, which is desirably at October 1 of 2021. But you're right, they are for a one-year plan and they're annually renewed. But our intent is obviously to have a long-term relationship with our partners.
Secretary Corbett, will this change the number of employees at the healthcare authority at all, or even over the next few years as the agency itself sort of changes?
What it will do is change the role that we play in the agency with our partners. Right now, we do a lot of the work that they're going to be doing. We're going to move to an oversight and management organization and working with them on strategy and innovation, as well as ensuring that their work is meeting the needs and the outcomes that we desire. So yes, we'll be transitioning people into new roles, new responsibilities, new skills, if you will, new opportunities.
But you don't anticipate having to lay anyone off?
At this time, we're not anticipating that at this point.
Secretary, earlier you said that you've asked for an attorney general's opinion on whether the healthcare authority
Why not wait for his opinion?
Well, what I said is that we've been directed by our board to seek an interpretation, if the Attorney General so choose, to help the board understand more clearly what their role and responsibilities are following that board meeting. I think some of our board members said they thought they was clear on their role and some did not. So I think maybe helping with clarity is something, but it's really up to the Attorney General if he sought to do that. The actions that the board took are very similar to the board actions they've taken for the last 18 months that I've been there. So I think to some degree, the clarity seems to have been clear up until this board meeting.
But you didn't request the AG's opinion.
I have made a call into the AG to seek if he would be interested in participating in that.
Governor, go ahead. I just have one more.
Sure.
I know one of the concerns I've heard is introducing for-profit organizations into this system. I know there are concerns about that. How do you alleviate those concerns that they're driven by profit and not by what's?
Yeah, I think the reality is maybe the only organization in the healthcare system today that's a not-for-profit in the real sense of the word is us. Most of our providers are in the business for profit or for surplus creation and things of that nature. What we're looking for from our partners is the ability for them to make investments, bring innovation, and really make a difference in what we need to be doing from a healthcare standpoint. It is clear that we have not had the ability to make the investments that some of the for-profit organizations have, and we're expecting to see significant improvement come from that, and the cost actually to be contained or reduced as well.
Governor, if you don't mind, we had a couple of reporters on Zoom that can't make it, that wanted just a quick preview of your business days and your priorities for the session.
Well, really looking forward to the State of the State on Monday and to continue. We had a great off session with the speaker and the pro tem. We've gone off site to really create a people's agenda, not a governor's agenda or a House or a Senate agenda, but a people's agenda. And kind of three pillars we're going to break down. Number one, I'm always going to be driving to become top 10 places for business. And so with that, there's a lot of policy initiatives that we're going to be rolling out. And then Oklahomans elected a business person as governor, and they want more for their money. They want Oklahoma to become a top 10 state in everything that we do, and hence why we're here talking about healthcare and changing our delivery process in healthcare for Oklahoma. And so we'll continue to drive efficiencies across state government and all the different state agencies. Got a great plan for that. And then we'll continue to invest in our fellow Oklahomans. We've got a great infrastructure plan. So I'm looking forward to delivering those remarks in more detail on Monday.